All right, so here we are. We're moving on with our second video for hypersensitivities to type 3, which is going to be mediated by IgG, and IgM is the antibody response. Antigen-antibody complexes are deposited in the tissue or the circulation. Neutrophils are attracted to the site and release enzymes that cause damage. And an example of these would be Raynaud syndrome. Immune complexes are deposited in the capillary beds in the peripheral circulation due to temperature. These complexes block circulation. So this is the one that is tissue specific only, or type 3 hypersensitivities. And then type 4 is the one that we talked about that does not involve antibodies. It's not. Type 1, 2, and 3 all are the antigen antibody complexes, whether how they react in the body, where they're deposited, the problems, whether it's tissue, cell, or just on the surface, or just in the lung. But hyper 4 sensitivity is not antibody mediated. It's more of a delayed reaction. You've got an antigen sensitized T cell which kills directly or release lymphokines which attracts T cells and macrophages to an area, which is then going to give you the inflammatory reaction and tissue destruction occurs. It's not the inflammatory reaction that we want to see. Like I said, this is over time and too much of a good thing, because we know inflammation is a good thing. It can help us recognize that something's wrong. But over time, if it's happening and it's not supposed to be happening, tissue destruction can occur. An example of type 4 hypersensitivities, I think I gave you a lot of autoimmune diseases: graft rejections, poison ivy, RAs, rheumatoid arthritis, diabetes type 1, Hashimoto's thyroiditis. So that's the type 4 hypersensitivity. And I wanted to talk about bee stings, just because that's another real common one where people can get anaphylaxis very quickly. It's a type 1 hypersensitivity. So we go back to which one? What's type 1? Let's go back and see. Is IgE mediated. And here we said immediate response to a second exposure, and it is mediated by IgE. The allergen is enzymes and other proteins in bee venom. About 1% of children have anaphylactic reaction to bee venom. If a child has had an anaphylactic reaction, 60% chance that they'll have another, and that's why they need to carry those EpiPens with them. Antihistamines are not effective, is already bound to our H1 receptors and have already initiated bronchial constriction. They just say, because you're like, well, there's histamine, why don't we give an antihistamine? They're just not effective. We need something. The histamine is so potent in one of these reactions that are IgE mediated, is that it's overwhelming, and that's why the person can't breathe, and the antihistamines don't react as well, and they react too slowly. So again, most common type of hypersensitivity, we need autonomic nervous system mediators. Epinephrine will bind to specific receptors on smooth muscle and reverse the effects of the histamine. So I'll say that again. Epinephrine binds to specific receptors on smooth muscle tissue, which is what we have in the lung, and reverses symptoms of histamine, resulting in muscle relaxation, which is what we need because it's constricted. Most of these people need to carry self-injectable epinephrine. And again, I already talked about, In the research, antihistamines have no proven clinical effect on immediate and life-threatening symptoms of anaphylaxis. They fail to prevent the massive release of histamine observed in anaphylaxis. They're slower to onset than adrenaline or epinephrine and have little effect on the blood pressure. They don't help with the bronchospasm, which is what you get for the severe constriction. Basically, antihistamines are used for relief of mild allergic reaction symptoms. Okay, so we're going to move on. Those are basically the hypersensitivities to autoimmune. And what is that? It's the body's immune system begins to recognize self-antigens as foreign. And autoimmune diseases can run into families, but sometimes they say not so much. It doesn't matter if one person gets it. It's like, why did their body kind of turn on themselves? Why would the body recognize self-antigens as foreign? And we know if it recognizes self-antigens as foreign, it's going to kill the cells, and hence we have disease. Most common autoimmune disorder is lupus. It's abbreviated as SLE. Systemic means it's going throughout your system. It's throughout the body. Lupus erythematosus because it affects a lot of the red cells. And here it is. Production of a large variety of antibodies against self-antigens, including red blood cells, coagulation proteins, platelets, lymphocytes, and more. It's a chronic inflammatory autoimmune disorder affecting the connective tissues, formation of immune complexes that deposit, and in depositing them there, they cause inflammation. So antibodies, just as a reminder, there are immunoglobulins, any of a large number of proteins of high molecular weight that are produced normally by specialized B cells from our humoral system after stimulation by an antigen and act specifically against the antigen in an immune response, that are produced abnormally by some cancer cells and that typically consist of 4 subunits of 2 heavy chains and 2 light chains, also called an immunoglobulin. So in this disease, our own antibodies are acting against, again, our self-antigens, our own red blood cells, our own proteins, our own platelets, and our own lymphocytes. It's like, well, why? Approximately around 16,000 are diagnosed annually. Occurs in women 10 times more than men, 15 times more often in childbearing years, so at a very young age. Sometimes they're diagnosed during pregnancy. And again, it is the most common, complex, and serious of the autoimmune disorders. It, again, characterized by the production of a large variety of antibodies against self-antigens, including not only erythrocytes, coagulation proteins, phospholipids, but nucleic acids, lymphocytes, platelets, and many other cells. There's an increased incidence in twins. Why they have a high incidence of anemia? Because it attacks the red blood cell. And we know the red cell is what carries the hemoglobin, which gives us our energy and makes us not anemic. There's no cure for lupus or most other autoimmune diseases. The goal, it's like, well, how do we care for them? Well, the goal is for treatment is to control the symptoms and prevent further damage by suppressing the autoimmune response. And usually we don't want to suppress that response because that helps us fight infection. But with these people, it's out of control because, again, they're having a hypersensitivity to their own antigens. Let's see, occurs worldwide, more prevalent in African Americans, 8 times more, and nobody knows why. Signs and symptoms affect many body systems. Sometimes it is difficult to diagnose and treat. And then just as a side note, medications that can spark lupus, procainamide, and you're going to be learning these later, but another name for procainamide is Procan, Procan, and Pronesto is Pronestyl. And those are pretty powerful drugs used for cardiac rhythms. Hydralazine is a vasodilator. And whenever we want to dilate the vessels, we want to bring down the blood pressure, so that's used for hypertension. And methyldopa, another name for that is Aldomet, Aldomet, and that's to treat hypertension. Some anticonvulsants that people have to take because they have seizure disorders can spark lupus. And then PCN is penicillin and sulfa, which are antibiotics. And then there's some hormonal contraceptives that can spark it. So interesting that we have these chemicals in the body that can actually help this along, this disorder. What to look for? The symptoms. Arthralgia is like 90% people feel pain in their joints. Renal disease is 50%. And again, it's attacking a lot of cells that help the kidney, much so blood-filled organ. Anemia, 50%, because again, we're attacking the red cells. Cardiovascular disease, 30 to 50%. So we've got lack of hemoglobin in the patients. They may have fever, anorexia, weight loss, malaise is like a flu type. Fatigue, again, due to lack of hemoglobin. Abdominal pain, nausea, vomiting, diarrhea, you can read the rest. Polyarthralgia, 90% of the patients have that, which means a lot of joints are having pain. Arth means joint. Algia is pain. Blood disorders, and again, you know how many cells it goes against. Anemia. Penia means lack of. So we've got lack of white cells, lack of lymphocytes, lack of thrombocytes, and an elevated ESR, that's erythrocyte sedimentation rate. A lot of times we just refer to this as the SED rate in the hospital, and that shows how much inflammation is in the body. And so that's elevated. All these other cells are depleted, but the inflammation rate is elevated because of this disease. Facial rash on the cheeks, it almost looks like a butterfly. It starts on the nose and goes out both cheeks. They're very sensitive to the sun, photosensitive. Renal disorder, again, seizures, psychosis, inflammation of the heart and lungs. So you can see I'm naming horrible things, why we call it systemic throughout the body. That's what systemic means. The onset can be acute or insidious, like just all of a sudden they're hit hard with it, or it can take years sometimes to even diagnose. So the treatment, medications, mild disease, NSAIDs for arthritis and arthralgia, and NSAIDs is like, it's non-steroidal anti-inflammatory drugs. Would be like ibuprofen for arthritic pain. Sun protection, we said they're photosensitive. Topical steroids would be like on the skin for inflammatory conditions. Severe disease, there again you see the fluorinated steroids, discoid lesions, and corticosteroids. Those are very, very tough drugs. Very, very powerful anti-inflammatory drugs, but they're tough on the body, so we're going to wait till we have to give those. And then if there's kidney or central nervous system would be the brain, immunosuppressive drugs. And again, steroids, we're going to try to manage that massive amount of inflammation that's going on in the body and try to diminish that inflammatory response that has gone haywire in this disease. Okay, so that's the end of this one, and I will see you in class. Take care.